energy medicine, not only from the standpoint of treatment, like acupuncture is kind of the original energy medicine, and then there's homeopathic treatment, which that's another form of energy medicine. So in homeopathy, you take a substance and you dilute it so much, there's really nothing left except the energy or the vibration associated with it. In this office, I use homeopathic principles in a diagnostic sense. So I think in 10 years, 15 years, patients will just expect to have a diagnostic evaluation done based on energy medicine principles. And technology is changing, and the principles are just becoming much better understood, and I just think that'll be the next trend. And you're more than likely, you're going to find it today being used in your alternative medicine practitioner office, but as time goes on, I expect to see it much more mainstream. I use muscle testing kinesiology as a form of diagnostic evaluation, and it was kind of invented in the 1960s, but it continues just to grow and advance. But it does it in a grassroots way because every practitioner approaches it from a little bit different standpoint, and everyone has a little bit to add to it. So, and there are also computer programs that can do an evaluation. But what they do is evaluate based on acupuncture meridians and the energy that flows through them, and the electricity that's being projected off of the person. There was several years ago. There was a person that was frozen up in the Alps, I believe, and as the glacier receded, they found him intact, and he had a lot of markings around his ankles and his low back, and it was determined that those were acupuncture points, and they were scarred. So when you scar an acupuncture point, it grows new nerve endings, and that's what a scar does. It has its cheap tissue, so it monitors it with more nerve endings. Well, that makes it more receptive to stimulation. So they had knowledge 7,000 years ago of acupuncture points, scarred the point to make it more sensitive. When they did X-rays and MRIs, they could see he had low back problems, and the points that were scarred were exactly the points we use today for those type of issues. So that knowledge goes back that far, and every day when I'm doing acupuncture, not every day I don't think about that, but it comes to mind occasionally that I'm using points that were used 7,000 years ago, and because they're effective, that's why we're still using them. I was first probably introduced just in school. There was Applied Kinesiology Club, and I would go to the club and see how it was done, and my mentor in acupuncture used kinesiology as a diagnostic technique to determine where the acupuncture points were going to be placed. So I started using it in that sense, and it just continued to evolve and grow and change over time to the point now where I rely on kinesiology and energy medicine as my guiding tool in the practice every day. And when we need to, we'll order blood tests or send out for an MRI or whatever needs to happen in the Western medicine scale, but I get a lot more detailed and nuanced information from the patient when I use muscle testing or energy medicine techniques in practice on a daily basis. But I was originally exposed early